Dose and other bad effects. The biggest injury of these drugs is that many are untested and unregulated. For some, there is some research support for effectiveness and safety, or evidence of traditional use by other cultures for centuries. While those claims of efficiency are based on sometimes skimpy research that may or may not include credible clinical studies. Even for effective medicines, the actual contents of herbal preparations are unknown. Furthermore, the user cannot rely on the instructions to be a reliable guide for effective or safe use. In the worst cases, instructors suggest use of dangerous amounts of the drug. In the best cases, the doses are estimations based on sparse research. Dangerous combinations with other drugs. Ephedrine and similar stimulants can be dangerous when taken in combination with monoxamine oxidase inhibitors, which are used to treat depression. A combination of these two drugs can lead to fatal increases in blood pressure or heart rate. The combination of ephedrine-like stimulants with caffeine is much likely to lead to symptoms of cardiovascular ratification, jitteriness, anxiety, and arousal than either drug alone. What is an herbal drug? Herbal drugs are simply from plant matter. Many of the drugs discussed in this book fall under that large umbrella. Many of the most common intoxicants are ultimately derived from plant products. Nicotine comes from tobacco plants, and many forms of alcohol are prepared by the fermentation of yeast in the presence of grain products. Most of the hallucinogens range from psilocybin mushrooms to be could be described as herbal drugs along with many natural stimulants, including caffeine, ephedrine, and cocaine. There are also herbal sedatives, hypnotics such as kava, that act very much like alcohol. Herbal drugs are touted as safe and effective because they're natural or normal constituent of the body. Herbal drugs are not regulated by the drug. Herbal drugs are not regulated by the normal prescription drugs are controlled in the United States. In 1994, Congress passed the Dietary Supplement Health and Education Act, or DSHA. This law says the FDA will not regulate any product which they define as the product intended for ingestion as a supplement to the diet, including vitamins and minerals, herbs, botanicals, and other plant-derived substances, amino acids, metabolites, constitutes, and extracts of any substance. Therefore, such drugs can be marketed without proof that they are safe or effective. The FDA can only remove them from the market if they can prove they are dangerous, a strict requirement, and one that shifts the burden of proof from those marketing the drugs to the FDA. Not all herbal drugs are ineffective or dangerous, but the buyer should consider several issues. First, what is the source of claims for effectiveness? Some herbal drugs have been used by credible, well-controlled scientific studies. Others have been used by other cultures for centuries in a carefully documented way. Unfortunately, there is little evidence to back up claims about many other drugs. Furthermore, there is growing interest in Eastern medicine that can sometimes lead to uncritical acceptance of herbal healing techniques. While many effective medicines derive from herbal sources, many ineffective ones do as well. The second consideration is the safety and reliability of formation. A frightening example happened in the early 1900s in the marketing of amino acid triphyllin. Triphyllin, a normal constituent of the body, is used by a so-called smart drug to improve medical function and facilitate sleep. It is a component of many foods and has no known hazards when taken as a nutritional supplement. However, still unknown contaminant and triphyllin from one supplier causes serious and fatal disease. Unlike ephedrine, PA enters the brain in high doses. It causes a release of dopamine and norepinephrine and causes stimulant-like behavior side effects. Normally, these effects are limited by the rapid metabolism of PA by monoamine oxidase in the liver and in the brain. Little is known about how high PA levels get when human ingest pharmaceutical compounds as supplements. There have been no investigation of this. PA has other unique characteristics, natural consistency of the brain, albeit a minor one, and over the years scientists have measured levels in the urine and blood of patients with a variety of disorders, including ADHD, schizophrenia, depression, and Parkinson's disease, in the hope of understanding whether there is a link there. These researchers find that mixing speculations is beneficial. lifting, depression after exercise are harmful, contribute to the acceleration of dopamine neuron death after monoamine oxidase therapy. So is PA natural or the dangerous sympathetic? We don't know. It is certainly physiological and behaviorally active based on a few studies. However, the same caveat exists for this supplement as many others. You're not guaranteed to get the doses advertised, and sometimes not even the molecule that's advertised. Synephrine is a similar story. This is a very close relative to the nasal decongestion and amphetamine, known as phenylephrine. It was used as a drug in the 1920s, but has not been marketed for many years. However, its sources of data 10% supplement is usually from immature green, several oranges. It is used primarily for weight loss and is a component of sports supplements. It has been used in traditional Chinese medicines for digestive problems. It is well characterized in animal studies as sympathetic measures to raise blood pressure, probably by stimulating. Finally, these drugs are often sold in complicated mixtures containing caffeine. Combinations of ephedrine and similar substances with caffeine are much likely to lead to effects on the heart and circulation, generates anxiety and arousal than either drugs does alone. Furthermore, the potential for overdose is given the free availability of both drugs. The effectiveness of ephedrine and PEA can be exaggerated, leading to dangerous increases in blood pressure in patients taking monoamine oxidase inhibitors for treatment of depression. These are just three examples of evaluating the effectiveness and safety of herbal drugs, especially those used as sports supplements that people are working out. Manufacturers are not required to prove efficacy or safety. If all that happens is that you waste your money on an ineffective product, which might have placebo value for you, then it isn't a big problem. Whether there's drugs that stimulate the effects of norepinephrine on the heart and blood vessels, like many of these sports supplements, the outcome of taking excessive amounts can be catastrophic. St. John's wort may be the most widely used herbal preparation currently on the market. It is an extract prepared from the same plant, heparin, that received recognition as an antidepressant following parts from a year of clinical trials that showed mild depression. Many people take St. John's wort to stave off depression or just to improve their state of mind. Most research shows that St. John's wort may have some effectiveness, but not as much as pharmaceutical antidepressants, especially in cases of severe depression. So why not take a little St. John's wort? But itself isn't partly dangerous, however, it is proved to have many negative interactions with other drugs, including some important medications. Melatonin is widely sold in capsule or tablet form in high health food stores as a treatment for jet lag and other sleep disorders, as well as a cure-all that can prevent aging in such as diseases as cancer. It could be called a prototypical herbal drug. Melatonin is the molecule released by the pineal gland, so it's a normal part of the human body. It has been the object of scientific studies, and some of the claims of substantial effects have been born in these studies. In fact, one of the most recently marketed sleep acids, Ramlton Resveram, is a melatonin mimetic, and several more are in development. On the negative side, however, scientists have established a clear, safe and effective dose. The safety of long-term use has never been satisfied, and the content of preparations marketed as melatonin is unregulated and varies widely. What is melatonin? It is a neurotransmitter that is structurally related to serotonin. It is produced mainly by the pineal gland or tiny gland that sits on top of the brain, by the retina and the GI tract, and by some immune cells. Melatonin is released only at night. Visual signals travel from eye to eye in the brain that sets circulation rhythm. The nerves that travel to the pineal gland cause the melatonin to release into the retina, whereas some actions. Melatonin is very fat soluble and easily enters the brain, whether from a pill or its own natural melatonin, and acts on receptors at certain places in the brain. Melatonin mainly acts on 2 receptors and has actions mediated by nuclear hormone receptors and its direct interaction with cellular constituents. And melatonin in sleep, the very marketed day-night river in melatonin release is one reason why melatonin is associated with sleep. Normally when drowsiness falls, the nerves that stimulate melatonin become active, which then act on its receptors to trigger sleep.